Hi, my name is Pratap Dungrani. This video presentation is a part of Assignment 1 of Information Management Unit. This video covers information management issues with the Health Department and implication of those issues. Organization that I have chosen is Ministry of Health and Family Welfare. The Ministry of Health and Family Welfare is an Indian government ministry charged with health policy in India. It is also responsible for all government programs relating to family planning in India. The current minister is Honorable Jagat Prakash Nada. The ministry is composed of 4 departments: Health and Family Welfare, Health Research, AIDS Control, and Ayurveda, Yoga and Neuropathy, Unani, Siddha and Homeopathy. The Department of Health deals with healthcare, including awareness campaigns, immunization campaigns, preventive medicines, and public health. On August 7, 2014, Wide Extraordinary Department of AIDS Control has been merged with Department of Health and Family Welfare and now be known as National AIDS Control Organization, that is NSCO. Now Ministry of Health and Family Welfare comprises the following 2 departments, each of which is headed by a secretary to the Government of India. The first is Department of Health and Family Welfare. The second one is Department of Health Research. Directorate General of Health Service DGSH is attached to the office of a Department of Health and Family Welfare and has subordinate office spread all over the country. The DGHS renders technical advice on all medical and public health matters and is involved in implementation of various health services. The Department of Health Research DHR was created as a separate department within the Ministry of Health and Family Welfare by the amendment to the Government of India Allocation of Business Rule 1961 on 17 September 2007. The department became functional from November 2008 with the appointment of first secretary of the department. The aim of DHR is to bring modern health technologies to the people through research and innovation related to diagnosis, treatment methods, and vaccines from preventions, to translate them into product and process, and in synergy with concerned organizations, introduce this innovation into public health system. The Department of Family Welfare, that is FW, is responsible for aspects relating to family welfare, especially in reproductive health, maternal health, pediatric, information, education and communications, cooperation with NGOs and international aid groups, and rural health services. The Department of Family Welfare is responsible for 18 population research center at 6 universities and 6 other institutions across 17 states. National Institute of Health and Family Welfare, South Delhi, International Institute for Population Science, Mumbai, Central Drug Research Center, Lucknow, Indian Council of Medicine Research, New Delhi, that is founded in 1911. It is one of the oldest medical research body in the world. Let us discuss the issue due to the lack of information management within Indian Health Department. The issues that are caused by poor information management are availability of doctor, detection of diseases, equipment for cure, infrastructure, innovation in technology, emergency help service, and medicines. The first issue is availability of doctor. India is a country with population more than 1.2 billion. Such country with a vast population needs more doctor, and unavailability of them can cause an issue. Bordering area of a district lack medical facility, with a majority of doctor failing to stay back, residents are suffering. DHR is unable to provide sufficient doctor in rural area due to the lack of information of that region, and hence curable disease become reason of death sometime in rural area. As per the survey, ratio of doctor to the population is getting worse every year. Implication of this issue is there is only 1 doctor per 1,700 citizens in India. According to World Health Organization, the ratio should be 1 doctor per every 1,000 person. While Union Health Ministry figures claims that there are about 6.5 lakh doctors available and India would need about 4 lakh more by 2020. We have example of Banita, who was in class 3, fell into a hot curry conundrum at her school in Girishchandrapur village. while she was waited for a midday meal. The 8-year-old suffered severe burns and was rushed to nearby primary health center where the only doctor was absent. After transferring from 3 different hospitals, she was declared dead by next morning. Reason was doctor not available. If lesson is not learned and changes are not made, we may see more cases like this. The second major issue is the detection of diseases. India is one of the most populated and polluted country in the world. Number of critical non-communicable disease issue may present in India, including chemical and radiological contaminants, preparedness for environmental emergency, and household air pollution. Doctors are not always aware about this disease because of less information shared, and by not sharing information it makes difficult to make cure and stop spreading to other. Implication of this issue is if doctors do not have knowledge of disease, then it makes hard for them to suggest any cure. While treatment may consume more time and patient has to suffer until treated with a proper method. Sometimes doctor assumes wrong disease and start treating without consultation. This overconfidence results into more pain and illness for patients. Deaths are recorded in many cases for the same reason. The third issue is equipment for a cure. Equipment have a significant impact on the quality of patient's care and account for a high proportion of healthcare cost. Health service needs to make informed choice about what to buy in order to meet priority health needs and avoid wasting limited resources. Despite the fact that there is a much wider range of different brand and item to choose from, selecting supplies and equipment is often given a little attention. This often results in procurement of items that are inappropriate because they are technically unsuitable, incompatible with existing equipment, spare parts and consumables are not available, or because staff not have been trained to use them. Implication of this issue is patient needs to wait for treatment when sufficient beds are not available, wheelchair or stretcher not in adequate number, surgical table is missing, basic equipment such as oxygen, spotlight, microscope are not purchased in advance, surgical instruments are not available, first aid equipment like stethoscope, gloves, small torch, blood pressure monitor, etc. not handy. Another important issue that health department facing is an infrastructure. In order to provide a better service, hospital needs to have a good infrastructure. But most of the government and a private hospital have an issue with infrastructure, such as limited parking space, no backup plan for power cut, rooms are not sufficient for patients, drainage not designed properly, etc. This happens when management do not have accurate information about average number of patients and a percentage of increase in every year. Implication of a bad infrastructure could be when a structure is not designed by requirement, then it will always face technical and non-technical issues. For an example, if hospital do not have any backup plan for a power failure, then it will create havoc amongst patients. Blocked drainage create water and a waste problem in a toilet and bath area. Many hospitals do not have a fire safety system for an emergency case. This can result into death and the loss of property. While constructing this hospital, important information regarding infrastructure is not taken into consideration, which results into failure. Next comes the issue with innovation in technology. Innovation in medical technology improves people's lives and brings the benefit of treatment to individuals whose condition may previously have been difficult or impossible to treat. With the time, technology needs to be changed. Many hospitals do not have a modern technology as they have never updated their knowledge and research. Record of new diseases are not generated effectively, which has caused lack of innovation. Health department is not successful to detect every possible disease as information is not shared amongst department. Many hospitals still use old equipment which are not capable to cure disease fast and effectively, sometimes failure. Information of new requirement in disease is vital in order to design new machine. Implication could be an improper diagnosis, sometimes failure to cure as efficient machines not available. Diagnosing new disease with the help of old technology may consume more time and it impact on the cost of treatment. Poor family faces financial problem during such type of treatment. Result is not guaranteed and the risk of life is always there. Issues with emergency help in Health Department of India. There is always a need of emergency service in the health department. In a country with vast population, emergency support needs to be considered always. Problem with this facility is that it is not fully available in rural area. Ambulance service is not provided to many backward region, and hence there is always a trouble for people living in such region. Sometimes hospitals are far from village, which result into service delay, or sometimes helps come after the death of patients. This situation arises when the department do not have accurate information about town and emergency service near that place. Rural area always faces issues with emergency support as there are no fully functional hospital around the place. Delay in emergency had caused many deaths in India. There are several incidents where a patient's life could have been saved if a treatment was available on the time. There are also many cases of accidents where due to delay in emergency help, people have died. Thousands of lives can be saved if emergency help arrives on a proper time. But without updating current information and updating with the required one, it seems difficult to decrease death ratio. Last comes medicine and their implication in Indian health department. There are several diseases that are not detected or not shared with the health department, which has caused lack of proper medicines. Symptoms not known cannot be cured by any assumed medicine. Doctors sometimes provides cure that are based on improper information and self-made assumptions, putting patient's life at risk. This may give temporary relief to the patient but can cause a long-term problem. Different diseases cannot be cured by the same medicine, or it cannot be used without proper information. Department of Health should collect data on a regular basis of new diseases and need to perform enough research before making any medicine and releasing publicly. Otherwise, it may increase the problem of patients. There are several cases of prescribing wrong medicine which has resulted into horrible suffering in a patient's life. References are available for further details and understanding. And thank you very much for watching this video.